Hi everyone, I hope you're all doing well. Over this past week I've had a few people call me with a complaint of broken teeth, and for people who aren't in pain, I've been suggesting they put a temporary material in at home. This is something normally I wouldn't recommend, but these are unusual times, so we're resorting to unusual measures. So I'm going to show you how you can do it yourself filling at home. So let's assume you have a broken tooth. I've put the broken tooth here. I marked it with black. That's your broken tooth. You can go to Amazon and get a repaired Dentemp. This is actually for recapping fillings, not fillings, crowns, but you can find something similar as a temporary material, and this actually does also work as a temporary material. So the first thing you should do is wash your hands, at least for 20 seconds. Good washing, which is good to do generally, just wash your hands. Then if you have gloves, put gloves on. Brush your teeth and then rinse with warm water. You want your tooth to be a bit moist. You don't want to have it completely dry. If there's something stuck in the tooth, you could use, these are Perio sticks. I got them from the pharmacy, but you can use toothpicks too. If there's something stuck, just unstick it with, just use this and remove whatever might be stuck in there. You know, if you can't, don't worry too much about it. Then you'll take the temporary material, use an applicator. It usually comes with an applicator, but if there isn't an applicator, you can use a Q-tip. Put the material gently on the moistened tooth, which you've brushed. Recap it, and then bite down. Let's assume this is your mouth and you're biting down. Bite down firmly. Then you might want to grind a little bit left and right, and then bite down firmly again. Keep that for a few seconds. If you want to be extra good, you could take a Q-tip and just rub the excess off. That'll help clear it afterwards. Just rub it off. There you go. And then bite down firmly again. You might get some on the top, on the opposing arch. Just use a Q-tip and remove that. It comes off easily. This material takes about 1 hour to set, so if you have some extra and you just remove it with a wet Q-tip, that's fine. But the main thing is to keep closed as much as possible, because you don't want it to be too high. You don't want it to be raised more than it has to be, because that could actually make it feel worse. So you want to keep closed. It's better to underfill it than to overfill it. Now, just as I said before, this is if you don't have any pain and you're okay, then this would work for some time. You can always call me if you're not sure what to do, and I can go over this with you. And if you do have a dental toothache, I am available. You just call me again at 212-567-3368 and leave me a message. Good rule of thumb, brush, floss. This is not a time to get a tooth problem, so that's important always, but more important these days. Thank you and stay safe.